So let's spend some time talking about how child physical abuse ultimately affects the children that experience it throughout their development. So it's likely that children that experience child physical abuse are going to be more likely to have issues not only physically, but also behaviorally and emotionally. And so we're going to kind of cover all of those different areas today when we look at the effects of child physical abuse. So let's first just start by talking about what happens physically or medically to a child that's experienced child physical abuse. So certainly bruising is probably one of the most common injuries received by a child that's experienced physical abuse. So typically bruising is going to occur when extreme force is exerted on a child's body. Often, abusers will injure the child or bruise the child in uncommon sites that are unlikely to be seen when the child is wearing clothing. So you might see bruises on the child's back, on their stomach, or on their chest in places where clothing typically hides those sort of physical marks. So if you're a medical professional or if you're caring for the child and you notice bruising in an uncommon place, that can be an indication that the child has experienced some type of physical abuse. Also, as we talked about earlier, any of those sort of physical injuries that you might notice on the child's body, lacerations, belt marks, any type of physical injury is going to potentially be a medical issue. Sometimes this can be things like head injuries or traumatic brain injury. So that's not something that you can necessarily see on the child, but if you're a medical professional working with the family, it might be something that comes up as a part of treatment that could result from child physical abuse. Often kids that have experienced child physical abuse will also have untreated injuries, so breaks in bones that have gone untreated for years and have healed improperly. Often medical professionals will see this on medical imaging tests like x-rays or other sorts of imaging exams. And so when medical professionals see that, it can clue them in to the possibility of child physical abuse. Child physical abuse, depending on how early it occurs and how often, so how frequently it occurs, can also result in neurological issues. Specifically, it can compromise brain development. So as we talked about earlier, often child physical abuse is associated with poor intellectual functioning or cognitive deficits. So this might be evident in the child's verbal ability, in their memory, in their language skills, in their ability to communicate with others, in how they solve problems, and also in their perceptual motor skills. So if there are issues in any of those areas, it might be due to the child abuse that they've experienced. If a child's experiencing any sort of neurological or cognitive deficits, it's also likely that this is going to affect their academic achievement or their ability to perform in school. So it's possible that they may have lower reading or math abilities, or just sort of lower functioning overall academically. Child physical abuse, or the experience of child physical abuse, is highly correlated with learning deficits or learning disabilities, and also just general lower IQ. Beyond medically and cognitively, how a child can be affected by child physical abuse, often we see behavioral and emotional problems in kids that have experienced significant child physical abuse. Typically, we see increased physical aggression and antisocial behavior in kids that have experienced repeated physical abuse. These kids are also going to be at a higher risk for substance use and drinking at an earlier age. You're going to be likely to see things like non-compliance with rules and authority from parents and teachers, and defiance even at times in kids that have experienced child physical abuse. You might also see increased fights or conflicts with peers outside of the home in kids that have experienced abuse. And there's also a higher rate of both perpetrating bullying behaviors and becoming a victim of bullying if you've experienced child physical abuse. When looking at how child physical abuse might affect a child at a social or emotional level, we see a lot of sort of internalizing symptoms in kids that have experienced physical abuse. So things like depression and anxiety, low self-esteem, increased suicidal thoughts, and feelings of hopelessness. So in addition to just acting out behaviors like fighting and bullying, we also see a high instance of internalizing problems like depression and anxiety. Probably one of the most common things that we see in kids that have experienced physical abuse are attachment-related problems. So you've probably talked about in other classes the different types of attachment and attachment styles. So things like anxious attachment, disorganized attachment, avoidant attachment, and then of course secure attachment. So in kids that have experienced physical abuse, you're most likely to see a disorganized attachment style. So what that comes from is not understanding or knowing when their environment is going to be safe, which creates that sort of disorganized style of attachment. So this disorganized attachment style can also potentially affect how the child relates to their friends or peers at school, and ultimately how their adult relationships are going to function. So in childhood, kids that have experienced physical abuse might have difficulty making friends. They might have difficulty just displaying pro-social behavior, like things like smiling and providing eye contact. They're going to be more likely to be rejected by their peers. They might also have difficulty with social skills, so difficulty understanding how to take another person's perspective, or just understanding social cues in their peer relationships. In looking at how child physical abuse affects kids' mental health, certainly we know that kids that have experienced child physical abuse may also have co-occurring mental health disorders due to that experience. So some of the commonly seen or commonly associated mental health diagnoses for kids that have experienced child physical abuse, certainly we see things like major depressive disorder. So for kids that have experienced child physical abuse, about 40% of them typically report symptoms of depression after that experience or during that experience. We see about 30% of kids that have experienced child physical abuse also having behavioral difficulties. So they tend to have externalizing disorder diagnoses like oppositional defiant disorder or conduct disorder. And then we also see a greater risk of things like ADHD, and as an adult, the development of borderline personality disorder. And probably one of the most common diagnoses that we see for kids that have experienced child physical abuse is post-traumatic stress disorder. We talked a little bit earlier about kids that have experienced child physical abuse being at a higher risk for substance use and risky behavior in adolescence. And so certainly the possibility of developing a substance use disorder in adolescence or adulthood is also a commonly seen problem in kids that have experienced physical abuse. So let's look at the long-term effects of child physical abuse. So what happens to kids over the course of their development or into adulthood after having this experience of child physical abuse? We tend to see a high correlation between child physical abuse early on in development and the likelihood of criminal or violent behavior in adolescence or adulthood. There's a higher likelihood of arrest for a crime after the experience of child physical abuse. We also see higher rates of antisocial personality disorder in adulthood for those that have experienced child physical abuse. And as we've already kind of talked about with the cycle of abuse, we're more likely to see perpetration of abusive strategies in kids that have been abused during childhood, either to their future children or their future romantic partner. So sort of that cycle of abuse, there is that connection between experiencing childhood abuse and perpetrating abuse as an adult. Some other sort of long-term effects that we see in kids that have experienced child physical abuse: higher rates of alcoholism and substance use or substance use disorders in adulthood in kids that have experienced child physical abuse. We also tend to see financial difficulties or lower SES in adulthood for kids that have experienced child physical abuse. In terms of emotional functioning as an adult, adults that have a history of child physical abuse are more likely to experience things like poor self-concept, frequent anger and hostility, panic disorder, anxiety, personality disorders, as we've already discussed, trauma-related disorders and symptoms, so things like PTSD and other types of anxiety disorders. Self-destructive behaviors, so some self-harm behaviors, maybe some risky or impulsive behaviors. And just sort of a general negative perception of interpersonal interactions and the future. Medically or physically, kids that have experienced child physical abuse are at risk for being overweight as adults, having high blood pressure, having high cholesterol, having high blood sugar and low oxygen consumption, and also at risk for things like allergies, arthritis, asthma, and bronchitis. So not only does child physical abuse have long-term effects potentially for a child's mental health, but it also has long-term effects on the child's physical health.